June 27 and 28, a total of 200 persons from villages along the Corentyne River were afforded the opportunity to benefit from specialized healthcare delivery. This is part of the Ministry of Public Health's plan to create access to healthcare in far-flung communities in Guyana. Welcome to another edition of InfoHub Extended. Delicia Haynes now tells us of a recent outreach of the communities of Orealla and Siparuta and how the services provided have benefited residents.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
Orealla, a riverine indigenous community, is located just over 50 miles off the Corentyne coast and has a population of approximately 1,200 persons. Siparuta is nearby with a population of 450 persons. Together, the health needs of these two villages may vary, which means residents are forced to travel great distances to access specialized healthcare services along the coast. Residents who have been living in the two villages for a number of years noted that it is costly to travel to Skeldon, Port Morant, or even New Amsterdam for healthcare.
Well, it's really helpful because the outreach that came to Orealla, we don't really have it often, and we have a lot of like sickness, like the extraction of tooth is one, the blood pressure. So sometimes when the hospital is not working, sometimes they have to work, the doctors and the health workers have to go out. So we don't face a great disadvantage at that area.
It is very beneficial because it's due to the poverty. People don't have money to really pay for these things out on the coast. So it is a very valuable services. So it should be done regularly.
So I believe that the government is a fair government, looking all over the country, each and every Amerindian village. This is the last Amerindian village in Guyana, and I believe that we should be get some more thoughts on us. For a very long time, doctor never come in and do such a things that where we eye tests and whatsoever, all people who sick, and so our council is trying for us, but they are not the government.
The Ministry of Public Health's Regional Health Department collaborated with the Region 6 Health Department to deliver a wide array of specialized healthcare services to the people of Orealla and Siparuta. These services include VIA screening, ultrasound screening, and HIV testing. Other services included chronic diseases, general medicine, and dental services. Director of the ministry's Regional and Clinical Service, Dr. K. Sheko, explained.
I want to tell you that in terms of our VIA testing, we had 4 persons tested, and out of that 4 persons, we had 3 that were normal, and we still have 1 that was inconclusive, and that person needs follow-up. When it comes to our voluntary counseling and testing, we had about 36 persons who would have been tested, and we had no one that was positive. When it comes to our dermatology, that is the skin, the doctor that deals with abnormalities of the skin, as well as the eye doctor or the ophthalmologist, we had 45 persons each that would have accessed such services. And of course, they would have had some abnormal readings, and they were referred for further follow-up. In terms of dental, we had about 46 persons that would have received services in those areas.
Meanwhile, in Siparuta, close to 60 persons took advantage of the services within a 3-hour period, taking advantage primarily of the ultrasound service and seeking assistance for general medical complaints. Referred to as a one-stop shop for a quick checkup, residents were happy that this initiative was taken to the two villages. Persons with children from as young as a few months old to the senior citizen in the area made a special effort to turn out and access the services brought to them free of cost.
To get to Corriverton or to the coast to get attention for things like skin is very difficult for persons within this area. The traveling and everything would put them off and wouldn't be beneficial for them. So coming here to Orealla would actually help in that way to get these things fixed. The ultrasound, well, that is something. Now, the ultrasound system that our mothers mostly will have to travel out to Corriverton to get ultrasound. Other persons will have to travel to Corriverton to get these things. You're already sick when you get out there. You travel sick because of the public transport system. It's not like the most comfortable journey to get out to Corriverton and those.
The outreach is a great help to the village, a great priority towards our health. And in my opinion, I'm so happy for this because for the past for the past years or so, this is the first outreach I experienced the ultrasound and the dermatologist.
The outreach was initially planned for the village of Orealla, but after hearing that Siparuta residents also face similar difficulties in accessing healthcare, it was extended to that village.
I really appreciate this outreach because plenty people that's sick, they're not able to go to Orealla because it's really hard. Sometimes we don't have a boat, and for fetch some of them you got fetch them, they don't walk. And we're really happy that this must always happen. Anytime you come to Orealla, please come to Siparuta.
So we the Siparutians just feel like Siparuta left out like most of the time because only Orealla pushing forward. And we are so happy. I'm so happy like a resident up here that you make it all the best and effort to come to check all the tests like HIV most likely in Siparuta.
Dr. Sheko expressed that the ministry's vision is for Guyanese to be among the healthiest in the Caribbean. Exercises such as these sets out to capture those lagging behind with poor health and to ensure that they are properly treated and diagnosed as necessary.
Indeed, we are very happy that a lot of the persons from this area came out because they would have heard of the services that were being brought here by the Ministry of Public Health. And even as I was speaking with one of the residents, they said that they were very pleased with what would have been achieved here today. And some of them are very happy because in cases like testing their blood pressure and their blood sugar, some of them, they had to be taught lifestyle practices in order to improve their blood pressure as well as their blood sugar.
Right now, as you look at me, my face seems different from what I am. Because right now, for a week now, I was ill, a terrible cold and pain in my body, in my joints and so forth. And I was just deciding to catch a boat to go to Corriverton to see a doctor or someone. And that would cost mainly about $25,000. So I'm very thankful for this outreach. It helped me a lot.
I never know say that I have sugar. But because I never go and check no doctor. But I know today is my day for know I have a disease or what they call it into my body, and I get help then from the medical. Well, I could try my best. What the doctor tell me not to do, I could try my best, if not to eat or to drink anything because I need a good health for my body.
I went to do a scan and I get through. Because when I went to New Amsterdam, I get push and turn there for this sickness what I have. And I thank God for this doctor who treat me, and he don't find nothing inside my womb.
Last October, a fully equipped state-of-the-art water ambulance valued at approximately $22 million was commissioned. This was much needed in the area for the transport of emergency cases to the quarantine coast for further medical attention. At that time, Minister of Public Health Waldo Lawrence, who traveled to Orealla to commission the water ambulance, noted that there are plans to expand healthcare delivery in remote areas. In this regard, priority will be given to infrastructure and human resources.
The river ambulance is just about one of the services that we would like to provide to not only Siparuta and Orealla, but also to all our hinterland communities. We are presently reviewing all of our health facilities to see what upgrade we need to provide to these health facilities so that we can offer more services.
This fits into a wider vision touted by the ministry to ensure health services in Guyana are accessible and adequate to every person, regardless of their location, ethnicity, or religion.
The ministry's policy is to have Guyanese to be among the healthiest in the Caribbean. So with that in mind, we have remote areas. So what we would have planned from the regional health services perspective is to ensure that outreaches are being done within those remote areas. And you would have seen Orealla was considered one. We have other areas that we need to go to in the different regions, like 1, 7, and 8. We need to go to places in Region 7 like Camarang and Kaikan and the different remote areas in even Region 9, Aishalton and its catchment areas, all the areas that are challenging when it comes to accessing the services at a regional hospital. So our plans is to ensure that in most or all of the remote areas, we meet the people there. And that is why we consider outreaches to be pivotal in helping us to achieve that goal.
In January last, 2 similar teams were deployed to Waipa and Karasparu in Region 8. Specialists are scheduled to be a part of outreach teams to Camarang, Lima Sands, and other far-flung communities shortly.
This has been InfoHub Extended. Thanks for joining us. Goodbye for now.